Hi, my name is Brian Hurley, and I work for an urgent care company called MedSpring. We have 7 clinics throughout the Austin area, and we see about 50 to 75 patients a day. Out of those 50 to 75 patients a day, I would say maybe 3 to 5% have literacy issues. So what I propose today is a plan to improve health literacy in the workplace. Patients with communication and literacy issues have left our clinics confused and not understanding what was presented to them. They've also experienced poor communication with our medical staff treating their illness, confused of their diagnosis, not understanding our treatment plans, been vague on their prescription medications and how to take them, and when and where their follow-up appointment is. So I ask you, what is health literacy? So, by definition, it's the degree to which an individual has the capacity to obtain, process, and understand basic information. When they do not have the ability to understand communication, it becomes a literacy issue. So why is it important? So that our patients can make informed, educated decisions based upon their health. For safety reasons of our patients, it's the right ethical thing to do and is consistent with our company's mission of helping all of our patients. Knowing how to identify these patients is key to helping others. So how can we do that? So patients who have language barriers are usually people with difficulty speaking their dominant language, difficult using speech patterns that are a little different, verbal and nonverbal cues, pronunciation difficulties, accents, and using sign language to communicate. New data from the U.S. Department of Education suggests that 22% of all Americans have problems communicating, hearing, and have some type of literacy issues. 1 in 6 patients that come into our clinic will have some sort of literacy issue and will be of a minority that does not speak any English at all. So how can we address literacy issue in our clinics? For one, we can hire more bilingual staff, at least 1 per shift. We can print their diagnosis and treatment plan in their native languages, use nonverbal cues to facilitate communication, utilize technology and other visual aids, repeat and paraphrase what's being said, have them communicate that to us, and use interpretation or interpreters or video relay for deaf or hard-hearing patients. By using these tools, we can solve the problems of language barrier issues, help literacy challenge, communicate with staff, assist our professionals to communicate effectively with their patients, give our patients an understanding of what's being said, understand their diagnosis, treatment plan, medications, and how to take them properly. In conclusion, we must all focus on improving health literacy in our workplace. We must never allow any of our patients to leave our clinics with not a clear understanding of what was being communicated to them. As a clinic, we must use these tools described as implemented into our patient care for literacy challenged patients. Doing this will ensure safety and understanding for all of our patients. It will also make us less liable as a company. It'll attract more patients to our clinics and leave us with a sense of security. So my recommendation that I propose is that MedSpring implement this program immediately. That all employees are trained properly and the program is managed by the regional executives. Thank you for listening.